This is a Rogue Media Network production.
Welcome to the show. Today, we are going to be talking to a physician leader whose career has been dedicated not only to caring for patients, but also advocating for the future of medicine all across Texas. Joining us today is Dr. Bradford W. Holland, a board-certified ear, nose, and throat specialist affiliated with Coriel Health, who serves patients throughout Central Texas. Dr. Holland recently made history as the first physician from Waco in more than 50 years to be elected president of the Texas Medical Association. Now, throughout his career, Dr. Holland's been widely respected not only for his patient care, but for his leadership in organized medicine. Now, he served as Speaker of the House for TMA, chaired TexPAC, led the Texas Association of Otolaryngology. Did I say that?
Otolaryngology,
Close.
yeah,
Laryngology.
close.
And helped guide physicians through the unprecedented challenges of COVID-19, if you all remember that. Well, as Texas physicians face growing concerns ranging from doctor shortages and insurance barriers to increased regulations and access to care, Dr. Holland is stepping into this leadership role really at a crucial time for healthcare in our state. So welcome to the show.
Well, thank you so much for having me.
So good.
Looking
You're my
forward to
neighbor too, which is kind of fun
right.
to catch up with you.
I'm looking
But
forward to this.
first, congratulations
Thank you.
on being elected president of TMA. What did that moment mean to you?
Well, it's been a long time coming for sort of the pinnacle of what I've tried to do in medicine, and that is to lead Texas and to try and make Texas a better place for both patients and physicians. But I've spent a lot of time working on policy and how we deal with both the government and payers and really reform this whole process that we call healthcare, which as we know, needs a lot of reform these days. But it was a very honored moment. I had my whole family down in Corpus Christi. This happened in April, and so it was a very special moment, but also the start of a very big job, which I take quite seriously. So.
And the first from Waco, I mean, that is just remarkable.
First from
In
Waco
a long
in
time.
a long time. In the
half a
early days,
century.
Waco had a much higher percentage. In fact, many of the early leaders of TMA were from Waco. So Waco had an early history, but then we've been in a little bit of a dry spell. So I'm happy to represent Central Texas and Waco and all the physicians in there.
Tell us a little bit about your journey in medicine. What kind of led you to the specialty of ear, nose, and throat?
I really didn't land on that very early in medical school, but I did know I was very interested in anatomy. I was an anatomy TA and liked the surgical aspects of things, the in-depth anatomy, and the ear, nose, and throat area has some of the most intricate anatomy of any part of the body. So I'd kind of narrowed it down between neurosurgery and ENT, and ultimately I liked the sort of types of questions that ENT answered and the patient load, like dealing with kids, and about 60% of my practice is kids. So it was just the right mix, and I've been happy ever since. I think I have the best specialty, no offense to anybody else, but very pleased with it. I'd choose it again, but delighted to have been a practicing ear, nose, and throat physician here in Waco for almost 24 years. So.
Well, you have spent more than 20 years, I guess, in patient care of all ages. What do you love the most about practicing medicine?
I think it's just the one-on-one interaction, and nothing is more heartwarming to me than to take a small kid who may have speech delay and hearing problems and to do something as simple as putting in ear tubes, which for me is a 15-minute
How
procedure.
many have you put in?
I stopped counting a long time ago, but probably up to 10,000. I don't know.
Yeah.
It's something like that. But how such a small procedure can make such a huge difference in someone's life. I think that's probably the most heartwarming thing and touching that we have it's a great mantle to wear to be able to offer that to folks. But the amount of trust that people put in you to operate on their child or even themselves, I take that very seriously, but that's why I really think it is one of the best professions, but wear that responsibility very seriously and realize what we can do for folks and what we should be doing for them.
Now, you've had a lot of leadership roles in medicine, as you kind of hinted to earlier. When did you first realize you really wanted to be involved in patient care and help shape healthcare policy?
Well, I moved back to Texas in 2002 to start my practice, having just graduated. And that was about the time that tort reform was happening, and realizing that what we did down in Austin in the legislature made a huge difference in the daily practice of patients and physicians. And so I think that was really, I just happened to come in at that time and really sort of was involved in the last year before that passed in 2003 of tort reform, which was one of the major happenings that led Texas kind of lead the way for being practice friendly and physician friendly. And so it was a great victory, but also whetted my appetite for realizing that what we do policy wise, how we deal with our legislators, how medicine can kind of go down to the state house and make a difference. That really was very eye opening for me.
Yeah, during those COVID days, though, you did help guide physicians through that pandemic, and the hybrid meetings, and I guess telehealth all, kind of blossomed.
That's right.
At that point.
Well, a lot of changes were wrought very quickly.
Yeah.
Both internally in terms of how physicians deal with physicians, how information flows, how supplies flow, disaster management. I mean, so much was stressed and in ways that had not been stressed that way in 100 years. So completely new systems. It was a very challenging time, and I think need to realize that we didn't really have a playbook even such. I mean, a lot of that had to be our best guess as to what we thought would be the correct thing to tell the public, to be cautious, to try not to have something that would be absolutely catastrophic. And certainly it wreaked a lot of havoc and cost lives and was a substantial hit on all of us in many ways. But
well, and it was just so mysterious in a way. I mean, nobody knew what was going to come from it.
It certainly opened our eyes to what can happen.
Yeah.
And a lot of medicine has been trying to keep our eyes open for these kinds of things, these pandemics. And even now in some low levels, we see that we aren't immune to these things. Even we hope we can deal with them in a better way. But this is the way science and biology works, and opportunistic infections, things that can find a niche, can wreak havoc if we're not very careful.
Yeah, absolutely. You've spoken openly, though, about the doctor shortage, the physician shortage in Texas. How serious is this issue, especially when it comes to communities outside maybe metropolitan areas?
Well, in the suburban and rural areas, which is a lot of what Central Texas is, it takes too long to see a physician. I'm very discouraged by that. It does take too long to get in.
Well,
to see
you
a
as
doctor.
a specialist know that.
Absolutely.
Now, you can't just pick up the phone and make an appointment at your office. You have to be referred, and all those
and that's
hoops have to be jumped through.
It's hurting patients. It really is.
Yeah.
But the problem is physicians can't just turn up the stream of creating more doctors. It takes medical school money, it takes residency spot money, and all of that's federally controlled. So we don't have the ability to all of a sudden produce more physicians. And while we're out there saying that we need to have more graduate medical education, we need to have more medical schools, we're still not way under what we should probably have even here in Texas. And we've doubled the number of medical schools since I graduated medical school in Texas in '97. There was 8 medical schools. Now we have 16.
Really?
But we still don't have enough. And they're predicting maybe as many as 16,000 physician shortage of primary care physicians in Texas in the next 10 years. And that is really going to stress the system.
Wow.
So that's what we're out there trying to talk about now, is just trying to increase that pipeline. We need more physicians, and the wait times are too long. We've got to tell Congress that that's something that they've got to look at, because the supply will ultimately have to come from approval of funding and approval of more medical schools.
So that's what's stopping young people from going into
We are
medical?
turning away qualified pre-med students all the time just because we don't have enough spots.
Not
We
enough
aren't creating
spots for them.
And we need to create more spots. So
Yeah.
we have to import foreign medical graduates to fill some of those positions even later down the line. And so there's a bottleneck, and we can't get more people enrolled without congressional approval. And that's kind of where the impasse is. But graduate medical education as well as undergraduate medical education is really a priority for us, because we need to educate more physicians domestically.
So patients are frustrated with these long wait times and insurance denials and difficulty just accessing care from a physician perspective. How do you view these issues?
Well, the daily life of a physician has changed so much, and the time spent trying to fight insurance and prior authorization review is one of the most frustrating things we do. I think it contributes to physician burnout more than almost anything. And we try to be advocates for the patient always. Of course, we don't work for the insurance company, so there's this third party that's getting in the way between the physician-patient relationship. And if I had to say one thing about what's wrong with healthcare these days, is that there's too many third parties in between us and the patient. The prior authorization being one of the greatest. It used to be just private insurance for the under 65-year age group, but now with Medicare Advantage and other things, it's become pretty much everybody has to go through some prior authorization. And the number of man hours that takes, the amount of time, the frustration, being told that you have to go through phone trees, it's just a major time suck for us and takes us away from caring for patients. And now they're using AI to do some of that denial and can be done in milliseconds without even a real person looking at any of this and then thrown back to us. And sometimes you can appeal it and sometimes you can't. But prior authorizations is really one of the greatest hassles that we face as physicians on a daily basis.
So what can be done to change that, do you think?
Well, in Texas, we've actually passed gold card legislation so that if you have 5 reviews, you're denied 5 times, and each time it goes your way, then you can have a gold card and not have to go through prior authorizations. That legislation is on the books. However, we're still not really enacting it the way that we should. So we hope to make some tweaks in that because Texas is farther down the road on that than almost any other state. We've passed gold card legislation. Problem is physicians don't know that they're gold carded. There's no official notification. The different plan, there's so many different plans. It's hard to know which one you're gold carded and which one you're not. So we have some work to do on that before it's really a functional system. But we are farther, and I should say we are closer to creating maybe a potential solution for that. And there's been some appetite at the national level, the Trump administration, to ease that process too. So there's a little bit of hope on the horizon.
Yeah, you really access social media, and I see a lot of little videos that you do talking about these issues that are concerning to you. And one most recently that I saw was about nurse practitioners. So let's talk about that. Well, maybe it's a more overarching thing, people practicing medicine without attending medical school. Why does this issue matter? Because it seems like nurse practitioners are kind of filling in the gap a little bit on medical care.
Well, the economics of it all is really what's driving it. Everybody's looking, costs are overrunning everywhere, so everybody's looking for a cheaper option. But patients deserve, and most patients in Texas, I think, believe that at some level, whenever they receive care, it's being looked at by a physician or at least supervised. And that's the way we do have it here in Texas. Not every state has it that way. I believe in a healthcare team. I believe it takes many members of the healthcare team to care for the patient. But the pinnacle of that should be the physician-patient relationship. And more people want to do things for which they are not qualified. And we have even non-medical people. We had an example here in Wortham, Texas, not too long ago of someone being hooked up to an IV by a non-medical person and got some potassium and was unfortunately passed away, of a young 45-year-old. That's the Jennifer Cleveland issue. And so we've passed the Jennifer Cleveland law that says you can't start an IV without medical supervision unless having some medical training. But between medical spas trying to do things that are medical without medical training.
I hadn't thought about that, but that's true.
Everybody is trying to do things. Everybody wants to practice medicine without going to medical school, as I like to say. And so we need to be very careful in this day and age about the level of training. Level of training does matter. Supervision does matter. And so anytime I tell patients you seek medical care, make sure you know who you're seeing, their level of training, and who's supervising that. But that's something we have to fight for every year here in Texas, is to make sure that physician-supervised care is the standard and that we don't let people practice medicine without a license.
So this is just really crucial for patient safety.
It is a patient safety issue, and in states that have really relaxed those laws, we've seen problems. So I think as the economics push everybody into all these weird corners, we do need to stand up for physician-patient relationship. We need to say that even in rural areas where that's the number one argument, is that we will get more folks to rural areas. But even rural people need that same standard, and relaxing the standards actually hasn't improved access in those places, because you still need the same number of patients really to start a practice, whether it's a nurse practitioner or a physician. So we don't believe in relaxing standards for anybody, but we believe in supervised physician care, because that's what we have in Texas, and that's really the safest.
Mm-hmm. A lot more I want to talk to you about, Dr. Holland, particularly about a leadership training aspect of what TMA is doing. But want to tell you that today's show is brought to you by Bumblebee Blinds of Waco and Temple. You can enhance your space with Bumblebee Blinds. Serving Waco and Temple, they offer a wide range of custom window treatments, a trusted certification installation team to make sure your job is done right, offering a warranty with every purchase. Call Kayla today for a free consultation. That's 254-844-7939, 254-844-7939. Stay with us. There is more of the show ahead.
It's the 2026 Heart of Texas Builders Association Parade of Homes, brought to you by the First National Bank of Central Texas. Tour a variety of homes at different price points, plus see the latest trends from beautiful kitchens to outdoor living spaces. See the latest colors and design patterns. This is your chance to walk through homes, meet the builders, and get inspiration for your own projects. The Heart of Texas Builders Association Parade of Homes, June 5th, 6th, and 7th, and June 13th and 14th. Tickets are available online or at any parade home. For more,
we're celebrating the Declaration of Deals at Allen Samuels in Waco. Right now, get $13,000 off a new Ram 1500 Lone Star, plus 2.9% for 72 months. Cash in on $13,000 off a new Ram 2500 Laramie Crew Cab, or choose 0% for 36 months, plus no payments for 90 days. Feel secure with America's best full-size truck powertrain 10-year, 100,000-mile limited warranty at Allen Samuels.
Come by, let's be friends.
it's the premier charity event of the year, the 2026 Central Texas Cattle Barons Ball, presented by Ascension Providence. A fun evening filled with great food and drink, dancing, a spectacular auction, and more. This year's theme is Nashville Nights, Neon Lights, and Bullfights. Get your tickets now, donate, or be a sponsor. Help support the American Cancer Society to find a cure. The 2026 Central Texas Cattle Barons Ball, October 24th at MCC Highlander Ranch. For more information, go to centraltexascattlebaronsball.org.
Like Allen Samuels always said, Waco has a lot to offer, and so do we at Allen Samuels Dodge Chrysler Jeep Ram Fiat. Come by, let's be friends.
Cleanse your body of accumulated toxins and embark on your wellness journey at your own pace. At Global Healing, we provide premium supplements to help your body heal naturally. Start your healing journey today at globalhealing.com and organichemp.com.
Designed to elevate the off-road experience, enabling adventurers to conquer any terrain. For 50 years, you've trusted us on your toughest recoveries, to your most breathtaking destinations, and in countless unforgettable memories.
At 4U Health, we believe wellness and lab testing should be accessible, inclusive, and yes, fun. With our tech-powered at-home lab test, you save time and money while feeling your best. 4U Health. Visit 4uhealth.com today.
For anyone that's in the car buying mode or looking for a car right now or a truck, I would definitely come by Allen Samuels, get to know the people here like I have, how well I'm taking care of the dealership and how well, service and any kind of warranty issues or those sort of things. Because of the way they take care of me, it's made me a Ram driver. And so I don't think they'd want to go anywhere else if they came here.
Like Allen Samuels always said, Waco has a lot to offer, and so do we at Allen Samuels Dodge Chrysler Jeep Ram Fiat. Come by, let's be friends.
Finance is evolving. Automation, data analytics, and AI are reshaping what finance teams do every single day. The best way to predict the future of finance is to be ready for it. If you want a head start, check out 365 Financial Analyst.
Earning an online certification is a quick and convenient way to gain industry-recognized credentials. Select your ACLS course. Print your ACLS certificate. You can print your certification wallet card. aclsnow.com.
Our patented handles were launched in 2018. We continue to push the boundaries of strength training. Join us in making your training more natural and effective. Visit Engels90.com to learn more and revolutionize your workout.
Cleanse your body of accumulated toxins and embark on your wellness journey at your own pace. At Global Healing, we provide premium supplements to help your body heal naturally. Start your healing journey today at globalhealing.com and organichemp.com.
If I had somebody that was looking for a car, I would definitely recommend Allen Samuels. The trust that I have, the care that they take, they genuinely want to take care of you. They really ask for your feedback when you go to the support department to make sure they're taking care of you in every way possible. So I really appreciate that they listen to your feedback.
Like Allen Samuels always said, Waco has a lot to offer, and so do we at Allen Samuels Dodge Chrysler Jeep Ram Fiat. Come by, let's be friends.
Enjoy a quiet atmosphere with beautiful river views at the Brazos Landing, located in Waco along the Brazos River across from McLean Stadium. Enjoy homemade dishes like shrimp and grits, chicken piccata, braised short ribs, prime New York steaks, and more. Plus, enjoy a delicious dessert like creme brulee or key lime pie. Open for lunch and dinner Tuesday through Sunday. Brazos Landing in Waco, the only place where I-35 and the Brazos River meet.
Sunday morning, woke up early. Almost flew out of my bed. When I know I'm gonna see you, can't keep my feelings in my head. So I wake up and I smile, yeah. I wear it on my sleeve. You are the one I can look forward to, the one I wanna see. And you are the apple of my eye, and you make me feel alive. Green eyes and that pretty smile that make me realize you're the apple of my eye. Yeah, she's my sunshine on a rainy day, a pillow for my head. And she got jokes when I'm feeling down. I got pleasure in my bed, and can no one bring her down. No, she don't care just what they say. No, as long as I got you, girl, things are going my way. You are the apple of my eye. You make me feel alive. Green eyes and that pretty smile that make me realize you're the apple of my eye. You're the apple of my eye, yeah.
Like Alan Samuels always said, Waco has a lot to offer, and so do we at Alan Samuels Dodge, Chrysler, Jeep, Ram, Fiat. Come by, let's be friends.
Earning an online certification is a quick and convenient way to gain industry-recognized credentials. Select your ACLS course. Print your ACLS certificate. You can print your certification wallet card. aclsnow.com.
Our patented handles were launched in 2018. We continue to push the boundaries of strength training. Join us in making your training more natural and effective. Visit Engels90.com to learn more and revolutionize your workout.
Cleanse your body of accumulated toxins and embark on your wellness journey at your own pace. At Global Healing, we provide premium supplements to help your body heal naturally. Start your healing journey today at globalhealing.com and organichemp.com.
Designed to elevate the off-road experience, enabling adventurers to conquer any terrain. For 50 years, you've trusted us on your toughest recoveries, to your most breathtaking destinations, and in countless unforgettable memories.
Health, we believe wellness and lab testing should be accessible, inclusive, and yes, fun. With our tech-powered at-home lab test, you save time and money while feeling your best. 4U Health. Visit 4uhealth.com today.
For anyone that's in the car buying mode or looking for a car right now or a truck, I would definitely come by Allen Samuels, get to know the people here like I have, how well I'm taking care of the dealership and how well, service and any kind of warranty issues or those sort of things. Because of the way they take care of me, it's made me a Ram driver. And so I don't think they'd want to go anywhere else if they came here.
Like Alan Samuels always said, Waco has a lot to offer, and so do we at Alan Samuels Dodge, Chrysler, Jeep, Ram, Fiat. Come by, let's be friends.
Finance is evolving. Automation, data analytics, and AI are reshaping what finance teams do every single day. The best way to predict the future of finance is to be ready for it. If you want a head start, check out 365 Financial Analyst.
And we are back with Dr. Brad Holland, who is serving as the president of the Texas Medical Association. And it's quite an honor to spend some time with you, but full disclosure, you are my physician as well when it comes to hearing, and I inherited really bad ears on one side of my family. And I worked in a business that had headphones, IFB, and now we listen to those earbuds and all this, and I try to make sure I don't have the volume up way super high, but I just know it's coming.
It's hard to beat both genes as well as exposure.
I know, exposure.
Sort of the name we
oh
do.
My goodness. When it comes to this kind of thing, are there things we can do to safeguard our hearing?
Well, industrial society more and more is becoming challenging to ears. Even the young folks, amount of time they spend with the headphone on. Parents can download governors that don't have the headphones go above 85 decibels, which is the safe level for 8 hours. And so, you can watch that. It can actually be measured as well on many of these smartphones. But being cognizant of it is the main thing, because people just sort of assume whatever happens in the young folks is not going to hurt them later in life. And we're not seeing it. We're seeing kids, 18, 20 years old that have the high frequency hearing loss already. So it really is a big issue how much we're exposed to.
Well, and when I go to loud environments, my phone, my watch will say loud environment. And sometimes it's at church, but anyway, that's a whole nother story.
Right.
But when I'm at like a concert or something, and it's loud, I'm always so glad to see if people have little kids that they put those sound diffusing headphones on them, because their little ears are
starting to be
developing.
an awareness, but even at the Baylor games, and we know the Baylor Pavilion was bragging about how loud it was, but we've got to be careful about those kind of things. So, protect what you've got, because it's your only set of ears your whole life, and it does add up. It is cumulative, so you just have to be very, very careful.
Yes, absolutely. Well, the TMA Leadership College focuses on teaching doctors leadership skills. Why is leadership training in medicine so important?
Well, I do believe physicians are natural leaders, but they're not necessarily natural in the way that we often need or they can be developed into. And that is being more in your community. That's always been a big part of medicine for me, is branching out in the community to talk about medical issues, but also to have those leadership positions where you're immediately an authority source. But what you do with that, we don't get much training in media training. We don't actually get a lot of negotiating and some of the legalistic parts of leadership, policy making. While more and more folks are maybe even getting secondary degrees than ever, Masters of Public Health or MBAs or other things, we still need to have a way to teach physicians how to be a physician sort of in the community and be a physician leader. And so the TMA started the Leadership College almost now 2 decades ago, and I was one of the first graduates of that as an inaugural class. But it's really become a great way for us to sort of grow our own leaders, but also teach them what's important here in Texas about how to function as a leader in terms of both the legislature and local government, and how to interact with folks these days in ways that show that you have some knowledge. So we take somewhere between 20 and 30 physicians all around the state every year and put them through a 1-year training program, and it's widely popular. The physicians love it, but that's really produced some folks who are now in the legislature. Dr. Ray Callis is running for State House down in Beaumont. Don Buckingham, who's our Texas land
Oh, I
commissioner.
know. You can really name a lot of physicians who have now gone on to legislative careers.
That's right. We like to encourage that as well, because we don't need just attorneys and retired folks in the legislature. And so we're fortunate to have physicians in the House and Senate. But even just not necessarily always at that level, but just having a knowledge of public health policy and how to affect that and be effective communicators and leaders. We found the Texas Medical Association Leadership College to be a fantastic outlet for that.
Yeah, I bet you're leading the way, really, on this kind of training.
We do have sort of a best practice among other state medical societies, and so a lot of people have looked at our leadership college for that.
So what are some of the reforms that you would like to see happen, like right as soon as possible in Texas healthcare?
Well, I think, if you look at between physicians and between healthcare systems and then the payers, the insurance companies, that's sort of three legs of the stool. The other two, besides physicians, have gotten extremely powerful, and that's health insurance and even the mega hospital systems. And that's produced this kind of imbalance that I think we're experiencing today. Everyone knows we need reform. Costs are skyrocketing, access is getting lower, satisfactions are getting lower. We need reform, and it's going to have to come, I think, sooner than later. First of all, we're just saying that I think it's time to say that employer-sponsored healthcare has been a failure. I mean, we're one of the only places that uses employer-sponsored healthcare, and that puts way too many people between the patient, who should be the purchaser of insurance, and then the physician. So that's been an experiment we've run for about 80 years post-World War II, and it's just not working. It's putting way too many middlemen in, and that's where the costs are going up. And the physician doesn't see that, the patient doesn't see that. It's all these other folks in the middle who are taking away all this and causing the cost to it. So that's the number one overriding thing, is to say we need to go back to where health insurance is a commodity, like car insurance or house insurance, where you purchase it, the patient purchases it, and then that's a deal between the patient and their company and the doctor. And we've gotten so far away with that and away from that, and so many middlemen that's what, if you were to chart out how actually the dollar flows and who's in control, it just is nauseating. It's a Gordian knot like you can not imagine. And so we need to start undoing that knot, and that's probably the first thing.
You also serve as a faculty member at Baylor University. Yes. How important is it in mentoring this young group of healthcare professionals?
I love the mentoring aspect probably as much as anything, and it's so rewarding. Medicine has been blessed that we do expect the best and the brightest to aspire to be physicians. That isn't necessarily in perpetuity. We need to maintain that, and I think trying to be a mentor, trying to expose the pre-medical students, Baylor students, even high school students to what the world of medicine is, that's an important part of maintaining that caliber of person to keep applying to medical school, which we expect. I think I'm a patient too, and I want bright, smart people to be caring for me. That's what we want in medicine, but we can't take that for granted. And so I am an advocate because I do think it's a great profession, but I also want to encourage young people to go into medicine. There's so much that's discouraging, and we've even had some national leaders say the future of healthcare is AI and a non-physician, and that's just not what I think the future of healthcare is. We are going to need people to care for patients. We're going to need the laying on of hands. It's not going to be in my lifetime that we have no patient-physician contact or robotic surgeries 100%. While that may be 100 years down the line, I don't think it's going to be in 15 years. We need people who can make that human connection to really relate with the patient. And so while we don't know what AI is going to do to any profession, I'm there to tell Baylor students and others that the profession of medicine is going to be one that needs people, needs smart people. It's a great and rewarding profession, and that's one of the things I think is my role as a mentor.
Yeah, and I got to help y'all out with, what was it, National Voice Day?
World Voice Day.
We've been talking about ears, but also the nose and the throat, the vocal cords and all that. And we heard some wonderful musicians sing, and it was really a wonderful program.
We continue that at Baylor, and it's usually in April. And it's nice because it's while you have days for pathologic conditions, vision impaired or hearing impaired. This is one day to celebrate the natural, healthy condition of the voice, and so it's been something I've been involved with for some time. And World Voice Day.
World Voice Day. That's what
right.
it was. Yeah.
Just kind of all aspects, the vocal pedagogy, the medicine, the physics, the science behind it, and then the performance. But it's a wonderful thing. Baylor runs it every year, and I encourage everyone to look for it. So,
it was
appreciated
great.
You speaking. You were a keynote.
Of course,
so.
I was there as a broadcaster,
That's right.
using my voice
A
that way.
professional voice user.
Well, through all these leadership responsibilities and the roles that you've served, how do you stay grounded in your day-to-day mission, really, of patient care?
That's right. On a daily basis, you can be humbled in medicine. There are things that still hit you and challenges. It's usually not a problem to find the things that keep you grounded and humble. But I also think that just the rewarding nature of it keeps you from getting your head too big. No one can do anything without a lot of people pushing in the same direction. And no one person is going to reform healthcare. No one person is really capable of even healing the patient, because it takes a team. So at whatever level I'm on, I try and remember that it's the team aspect of things that is really both caring for the patient, but on a policy, making the changes that we need.
Well, looking ahead, what top priorities do you have as president of TMA? And how long is your term?
It is just a year.
A
It's
year?
always
Oh,
been
okay.
1 year. I'm the 161st president of the Texas Medical
Okay.
Association, so it's run that way for a long time.
Yeah.
We do have, with the coming legislative session starting in January, we do have a platform that we're trying to push forward that gives more power back to the patient through the physician. And we have so many things that are good ideas that are disallowed right now. Physicians can't own hospitals, believe it or not. A plumber and a banker can own a hospital. An attorney can own a hospital, but a physician can't own a hospital.
Why is that?
Well, that goes back to one of the negotiations for the ACA in 2010. The Affordable Care Act had a provision that no more physician-owned hospitals. They thought that was too much of a kickback. But physician-owned hospitals, and there were a few that were grandfathered in, or still continue to be some of the higher quality, lower cost. And so there's so many rules like that, including stark laws that prohibit physicians from being entrepreneurs and ingenuitive, and frankly would give us a lot more options, which I think would be a pressure to deflate prices and to control prices. We need to open those things up so that physicians can both be entrepreneurial but also innovate in healthcare and give more options. And so between stark laws and physician ownership of hospitals, that's one of the main reforms that we're pushing for.
Good. Well, I like to end these little discussions with a questionnaire similar to the one the late, great James Lipton would use on Inside the Actor Studio.
Yes.
So this is my take on it. So I'm going to ask you, Dr. Holland,
Yes.
what is your favorite word?
Word. One of my favorite words is not actually a word. I always like combobulate, because discombobulate is a word I use so much. So I say,
I've never heard it used that way.
We've got to
before,
combobulate.
It is. Let's combobulate everything.
That's
I
right.
like that. Okay, so what is your least favorite word?
Provider. That is such a generic term that means nothing. Anybody that can call themselves a provider, and I don't think medicine is a provision. So medicine is an art and a science, and you don't hand out healthcare like you hand out bandages or socks or cans of beans, which I consider provisions, where you don't care where you get them or who gives them to you. Medicine is about the relationship with the physician, and it's a caring art. And so to be called a provider, it just gets my hackles. It's one of my least favorite words, to be called a provider.
How interesting. I love that, though. I'm so glad you explained that. I really, really like that. Okay, so I'm going to ask you, what turns you on creatively, spiritually, or emotionally?
Well, music, especially spiritual music. I think I've always been a fan of music, and of course, even our wonderful Waco Symphony here. I had many years working with them. But music seems to hit in the soul, and that's one of my favorite things for my wife and I to do together too, is go to live music with ear protection.
That's right. Not too loud.
But music and spiritual music seems to hit me and twangs the heartstrings, and that's really what I have an emotional connection to.
Oh, good. Well, then what turns you off creatively, emotionally, or spiritually?
I think anything bureaucratic, seeing the amount of red tape that almost every process has to go through, especially some things with physicians and as you mentioned, prior authorization, but just the amount of paperwork that we're having to do, the number of clicks, to get a result nowadays can take 45, 50 clicks. And
10 years ago, people wouldn't even have gotten that, really, when you think about it.
I literally have, I think, 25 different passwords, all which by regulation have to change every 3 months.
Oh, gosh.
It is just something else to be able to keep up with all these systems and EMRs and radiology systems, and so that's what turns me off is dealing with that mess.
Well, that's true. Okay, so you're a ENT guy. What is your favorite sound?
Favorite sound? Well, let's see. I think probably the ocean is one of my favorite sounds.
I hear that a lot. Running water, any kind of water, but
that's right. I'm a trout fisherman, so standing in the middle of the stream, I think that's probably one of the best sounds. The rippling brook around that's trout seldom live in ugly places, I've found, and whenever you can hear that sound, it's usually a good thing.
That's going to be okay. What's your least favorite sound?
Least favorite sound. Well, anything too loud. I'm very aware of sounds, and so, boy, some of these alarms that go off, fire alarms, I know they're supposed to be safe, but by gosh, there's a lot that can really hurt your ears these days. So anything noxious that we hear is probably, I'm much more aware than the average person about that.
Okay, so when did you determine you wanted to go into medicine? Did you tell me that?
Medicine was back in my early days of college, and I was trying to decide between politics and medicine. And
so the question is, was there something else aside from what you've done that you really wanted to do or might still try to do?
Well, I went and did an internship after my freshman year of college in D.C. I worked for a senator. I was growing up in Colorado, so went out to D.C. and did a U.S. Senate internship for Senator Armstrong. And so I thought very heavily about politics and political science as a major. But I decided my love of science and both between loving science as well as loving the human interaction, I thought medicine was the perfect meld for that. And if I ever did want to get into politics, I said go be something first, and then maybe that'll come around rather than going directly into politics. And I think that's been a good decision. I've dabbled in not actually truly elected office, but in politics in many ways, and it's been very rewarding.
So what job do you know, I don't want to do that, somebody else can do that, no thanks?
I would say any major governmental administrator. Running some of these big organizations that deal with especially health, boy, that's a daunting task. Not many thanks and lots of complaints. But from our state health secretary to even at the national level, the folks that are administrating some of these major institutions for our health and human services. Boy, that's a big job, but that's too tough. So.
Okay, one last question. When you arrive at the pearly gates, what do you want to hear the Lord say?
Well done, good and faithful servant, hopefully. Spirituality has been a big part of my life and Christianity, and I think if you don't live for a purpose, live for a greater good, but also a greater being, and so I count myself as a Christian and a follower of Jesus Christ, and I think there is reckoning. I think people do keep score. It's not just that everything what makes you feel good, go do it. I think we've gotten off on that too much. It needs to be what's right and moral and upstanding and helps your fellow man, and so that's the way I try and live my life, and I hope I'll be judged accordingly when we get to that pearly gate moment.
Well, I appreciate so much everything you're doing for medicine, everything personally for me with my ears and voice and all that, but just certainly through the Texas Medical Association, and what a big job for you to take on, but appreciate so much you carving out a little time for us here today.
Enjoyed talking with you, and thank you for having me.
Thank you. Stay with us. There is more of the show ahead.
It's the premier charity event of the year, the 2026 Central Texas Cattle Barons Ball, presented by Ascension Provident. A fun evening filled with great food and drink, dancing, a spectacular auction, and more. This year's theme is Nashville Nights, Neon Lights, and Bullfights. Get your tickets now, donate, or be a sponsor. Help support the American Cancer Society to find a cure. The 2026 Central Texas Cattle Barons Ball, October 24th at MCC Highlander Ranch. For more information, go to centraltexascattlebaronsball.org.
For anyone that's in the car buying mode or looking for a car right now or a truck, I would definitely come by Island Samuels, get to know the people here like I have, how well I'm taking care of the dealership and how well, service and any kind of warranty issues and those sort of things. Because of the way they take care of me, it's made me a Ram driver. I said I don't think they'd want to go anywhere else if they came here.
Like Alan Samuels always said, Waco has a lot to offer, and so do we at Alan Samuels Dodge, Chrysler, Jeep, Ram, Fiat. Come by, let's be friends.
Earning an online certification is a quick and convenient way to gain industry-recognized credentials. Select your ACLS course. Print your ACLS certificate. You can print your certification wallet card. aclsnow.com.
Our patented handles were launched in 2018. We continue to push the boundaries of strength training. Join us in making your training more natural and effective. Visit Engels90.com to learn more and revolutionize your workout.
Cleanse your body of accumulated toxins and embark on your wellness journey at your own pace. At Global Healing, we provide premium supplements to help your body heal naturally. Start your healing journey today at globalhealing.com and organichemp.com.
Designed to elevate the off-road experience, enabling adventurers to conquer any terrain. For 50 years, you've trusted us on your toughest recoveries, to your most breathtaking destinations, and in countless unforgettable memories.
Finance is evolving. Automation, data analytics, and AI are reshaping what finance teams do every single day. The best way to predict the future of finance is to be ready for it. If you want a head start, check out 365 Financial Analyst.
At 4U Health, we believe wellness and lab testing should be accessible, inclusive, and yes, fun. With our tech-powered at-home lab test, you save time and money while feeling your best. 4U Health. Visit 4uhealth.com today.
Enjoy a quiet atmosphere with beautiful river views at the Brazos Landing, located in Waco along the Brazos River across from McLean Stadium. Enjoy homemade dishes like shrimp and grits, chicken piccata, braised short ribs, prime New York steaks, and more. Plus, enjoy a delicious dessert like creme brulee or key lime pie. Open for lunch and dinner Tuesday through Sunday. Brazos Landing in Waco, the only place where I-35 and the Brazos River meet.
Ain't no sunshine when she's gone. It's not warm when she's away. There ain't no sunshine when she's gone. This house, it ain't no home. Anytime she goes away, wonder this time where she's gone. I wonder if she's gonna stay. 'Cause there ain't no sunshine when she's gone. This house, it ain't no home anytime that she goes away. I know, 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 I know. Hey Lord, I'm gonna leave that young thing alone. There ain't no sunshine when she's gone. Ain't no sunshine when she's gone. It's not warm when she's away. There ain't no sunshine when she's gone. This house, it ain't no home anytime she goes away. Anytime she goes away. Anytime that she goes away. Sitting here watching the sun slowly fade away. One thing's missing from my perfect day. My constant companion through all life's ups and downs. The best man on my wedding day. Now he's a friendly fellow, you probably met him too. He's tall and cold, and he tastes good as well. He's a hard-working guy, to tell you the truth. So let me tell you just what he can do. He makes a great nightcap when you're sleeping on the couch.
It's our declaration of deals, and savings are moving fast at Allen Samuels Jeep in Waco. Get a 2026 Jeep Wrangler Sport for just $32,990. Or take $10,000 off a 2026 Jeep Grand Cherokee Summit. Or qualified buyers can get 0% APR for 36 months and no payments for 90 days. Don't stand still. Drive today. Allen Samuels.
Come by, let's be friends.
It's the 2026 Heart of Texas Builders Association Parade of Homes, brought to you by the First National Bank of Central Texas. Tour a variety of homes at different price points, plus see the latest trends from beautiful kitchens to outdoor living spaces. See the latest colors and design patterns. This is your chance to walk through homes, meet the builders, and get inspiration for your own projects. The Heart of Texas Builders Association Parade of Homes, June 5th, 6th, and 7th, and June 13th and 14th. Tickets are available online or at any parade home. For more information, go to wacohomeparade.com.
Somebody that was looking for a car, I would definitely recommend Allen Samuels. The trust that I have, the care that they take, they genuinely want to take care of you. They really ask for your feedback when you go to the support department to make sure they're taking care of you in every way possible. So I really appreciate that they listen to your feedback.
Like Allen Samuels always said, Waco has a lot to offer, and so do we at Allen Samuels Dodge, Chrysler, Jeep, Ram, Fiat. Come by, let's be friends.
Apollo Neuro is a new kind of wearable that helps your body recover from stress, that helps you calm down and feel better. You sleep better, and you can get back to being yourself. Learn more at apolloneuro.com.
I had a panic moment running my hands through my hair, and that's when I found Keeps. Keeps gave me the results that I was really looking for.
I definitely felt a lot more confident once I saw my hair coming back.
Keeps has given me the control of my hair back.
Get your first month free at Keeps.com.
It's not just a glove, it's a 44 Pro. Crafted with dedication, made for performance, and built to last. Get your custom glove today at 44pro.com and experience the 44 Pro difference. That's 44pro.com, 44 Pro.
This is a Rogue Media Network production.